might be looking bad for the eye which has been operated. So let's not give him both the eyes red and both the eyes looking ugly. So both the points very well taken. Thank you so much for summarizing it nicely, Dr. Anand. We move on to the last topic of the debate session here, which is dilate every cataract patient before cataract surgery. I understand the motion to be dilate every cataract patient in the OPD before subjecting him to cataract surgery is the motion. Speaking for it from Ludhiana, Punjab, here comes Dr. Dinesh Garg. Dinesh, sir, please start sharing your screen. We are ready when you are. Go on to the presentation mode, sir.
Can you see?
Yeah, of course, we are in transition. Yes, now we can see the slideshow, sir. The clock starts ticking for you now.
So this is like dilate every cataract patient preoperatively before you take up cataract surgery. We as ophthalmologists and cataract surgeons, we are all obsessed with cataract surgery or surgery either to do bilaterally, who will do, who should deal with the complications. But most important is what the patient wants. And he wants excellent surgery 6/6 vision. So I want that he should be dilated preoperatively and we should know what we are doing. So I am for dilating every cataract patient before cataract surgery in the preoperative checkup. I don't have any financial disclosures to make. So the outcome of IOL implantation, even after the excellent bilateral surgery done by Dr. Cyrus, is dependent on the health and function of the macula. Every patient these days expects 6/6. So in-depth examination of the eye is a must before surgery. So let me start by saying this, that the time spent preoperatively on pupillary dilatation is the time well spent, whether you are a high volume surgeon, premium IOL cataract surgeon, whether you are working in a charitable hospital, corporate hospital, solo practice or group practice. Satisfied patient is our best advertisement. And that's long way or in a long innings into the profession. A comprehensive clinical examination, including dilated fundus examination, is a must, because in preoperative phase, we are planning to do cataract. Then intraoperatively, we execute that, and postoperatively, we deliver the services which we are hired to do or which we are being paid for. And the quality of that delivery is going to matter throughout life for that particular patient. So it gives a very useful insight into the expected postoperative results, like how the pupil is going to behave during surgery, what will be the maximum pupillary dilatation, are there any synechiae, will you need any iris hooks or expanders, and how much cataract hardness is there, what is the type of cataract, is there any subluxation, what is the health of the zonules, is there any phycogenesis, pseudoexfoliation. All these things need to be ruled out beforehand in the planning stage before we go ahead and venture into doing cataract surgery, execute, and before we land up in any such kind of a trouble, before we say that we have implanted a multifocal IOL, but you can't see because you have a ARMD or you have some other disease at the retina or a macular scar. So I'm sorry, I'm not going to do that. So you can have visual surprises, you can have problems, you can have uveitis. All these things will trouble you throughout. The patient will keep coming back to you. You can prevent retinal detachment if you are able to preoperatively locate any breaks or holes or lattice and treat it accordingly if needed, if you are going to have any intraoperative difficulties. So friends, I would say it is better to be safe than to later on. If you miss any pre-existing condition, the patient is going to put it onto you and say that, oh, cataract surgery has done this to my eye. If you have diabetic retinopathy preoperatively and you have not assessed, you have not treated, and the CME increases, it's all going to come onto you. If there is uveitis, you have to plan how stable it is. If there is ARMD, you have to treat or at least time your surgery and avoid a multifocal lens. So the take-home message in this is, we are in the service sector and eye care is an integrated part of that. A happy and a satisfied customer is our best advertisement for the long term. We must promise less and deliver more. Quality of service delivery is going to be the key. Better safe than saying sorry later on. So you must dilate all the patients coming to SICS or FACO or flats or whatever you want to.